I'm Iris Elliott and I'm Head of Public Affairs and Policy at Niamh, the Northern Ireland Association for Mental Health. This podcast is to introduce you to transforming your care and to give you ways to get involved in the current policy consultation. Transforming Your Care is the name of the policy that is going to completely change the way that health and social care services are delivered and funded in Northern Ireland. Transforming Your Care is also suggesting that there's an increased role for voluntary organisations such as Niamh to play in the delivery of health and social care services in Northern Ireland. This will mean changes for what public services provide and what voluntary organisations like Niamh provides. We at Niamh are going to write a response to the consultation document, and we want this response to be based on your experiences as people who experience mental ill health, as staff and volunteers who are involved in mental health services, and as carers. You may want to come to one of the 2 mental health events that we're organising in January, and if you do, you'll be able to talk directly to the team who are responsible for transforming your care. You might want to talk about transforming your care in your local service and let us know what you think. Or you may want to write directly to the Transforming Your Care team, for example as an individual or from your local service. Transforming Your Care will affect everyone in Northern Ireland, and so we want everyone who's involved in mental health to contribute. Most important are the people who experience mental ill health, because you know what it is like to be unwell and also what support you need, from whom and where. Often people who experience mental ill health have a lot of physical health problems as well, so it's important that general health and social care services also meet your needs. You're of all ages, you're parents, you have other disabilities, you use services in the community and in hospitals, and so it's important that all these services meet your needs. The consultation is also aimed at carers, at staff in mental health services and volunteers. It is important that all your expertise is drawn on so that Transform Your Care delivers real change in mental health. The Minister for Health, Edwin Poots, asked for a review of how health and social care services are working in Northern Ireland, and this was published in December last year. Since then, a lot of work has been done to look at the health and social care needs in each of the health and social care trusts across Northern Ireland. This information is included in what are called population plans. So a lot of work has already been done, and now there are detailed proposals for how health and social care services could look in the future. You are being asked, are these the services you need and want? Where should these services be delivered? Who should deliver these services? That could be by public organisations, community and voluntary organisations and charities, or private businesses. The consultation document talks about improving the health of the whole population, improving the health of specific groups such as older people, people with long-term conditions, people with disabilities, including people who experience mental ill health, and improving the health of people at different stages of their life, such as maternity and child health, family and child care, and also palliative and end-of-life care. It also talks about improving the delivery of health and social care services in particular locations, in your home, in your community, and also in hospitals. The consultation document talks about how these services are funded. One proposal is to have what are called personalised budgets. This means that individuals can make a direct decision about how money allocated to him or herself for support is actually spent. Integrated care partnerships are being proposed as a way of getting local health and social care services to work more closely together. This is an important development, and there is a podcast about integrated care partnerships on the Transforming Your Care website if you want more information. We think it's important that you comment on all health and social care services, but I want to give you an idea of what is specifically said about mental health services in the Transforming Your Care consultation document. Transforming Your Care wants to raise awareness of mental health issues and reduce stigma. It wants to improve the mental health and well-being of all people in society. It wants to ensure that there are clear ways to access support and also to provide early intervention. It wants to promote recovery and independence for people who experience mental ill health, and it wants to end long-term institutional care and also resettle people into the community. Transforming Your Care talks about increasing support for carers and also enabling individuals who have to have greater choice and control over the type of care that they receive. It's proposed that there will be 6 inpatient acute mental health units across Northern Ireland, and that these will be developed for people who are aged 18 years and over and would be located close to an acute hospital. One site would be in the Northern Trust area, the Southern Trust area, the South Eastern Trust area and the Belfast Trust area, and 2 sites would be in the Western area. Plans to locate services in the Ilma area have been changed, and your views are sought about this. The Minister for Health, Edwin Poots, has said that he wants to hear what you think about the draft plans for health and social care services. The deadline for hearing your views is the 15th of January next year. To help you understand what is involved in transforming your care, we've put links to the consultation document and the questions that the Transforming Your Care team want you to answer on the Niamh website. Because the consultation document is long, at almost 80 pages, we've also included a link to the easy to read version of the document. As well as this podcast, there's an audio recording with the same information. If you want to get a hold of these documents, just ask a member of staff in your local service. You may want to talk about transforming your care in your local service, perhaps at a partnership meeting. If you have issues that you would like us to include in the response that we're writing, you can send them on to me directly or ask a member of staff to pass them on. We would really love you to come to one of our consultation events to hear more information and to tell us what you think. Also, it might be interesting for you to hear what other people think should be included in transforming your care. In order to help you get involved in the consultation in a meaningful way, we're holding 2 events in January to hear about your experiences and what you would like health and social care services to deliver for you, your family and your community. The events will be held in Belfast and Dungannon in January. If you come to one of our consultation events, you will hear this information from members of the Transforming Your Care team directly and also be able to ask them questions. We hope to see you there.